Good afternoon, this is Dr. Do again. This video is an alphabetical list. We're on B letter, and last time we talked about the blood as a connective tissue and associated disease with blood. Today I'll just continue to finish because yesterday we mentioned the plasma, which is the ground substance and have the proteins and the red blood cells, and associated disease like bleeding disorder or hemolytic or anemia, etc., etc. And then we move on to the white blood cells. There are a variety of white blood cells. The neutrophils and lymphocytes, which I mentioned yesterday, are the most important one. There's some other like basophils, eosinophils, and the monocytes, etc. And also I mentioned that the body immunity, we have three lines defense mechanism. The first line is the mechanical barrier, like the skin, the mucus, and also some chemicals, for example, hydrochloric acid in the stomach, or there's acid coating on the skin called mantle. So these are the first line. Second line immunity refer to the neutrophils, the complement or the interferon. These are the immunity does not require memories, and the cells, when there's a respond directly to the stimulation, for example, the bacteria invasion or the virus invasion, or the abnormal cells circulating the blood. So these cells will just go there directly to engulf those foreign bodies, or the bacteria or virus just break those, destroy those bacteria. So this is the second line. And the third line immunity refers to the cellular and humoral immunity, which involves memory function, either the T cells, the cytotoxic cells, or the B cells produce antibody. So these are the three lines of defense mechanism. Talk about the defense mechanism, talk about the immunity. We just, especially this coronavirus outbreak time, talk about the vaccine production. So I'll just briefly mention about the vaccines. So the body immunity has active form or passive form. And the vaccine we usually refer is the gave the antigen. Okay, for example, what kind of the vaccine we use, tetanus, for example, we gave the toxin, which is produced by the bacteria, but it's inactivated, treated. So when the toxin injected to our body through the immunization, our body recognizes as foreign protein, so generates antibody against this. So this is the active form of the immunity, so vaccine, for example. The passive form immunity, which means our body received the antibody directly. For example, dog bite, the rabies. After the dog bite, the dog was not immunized, so there's a risk might develop the rabies. So then at this time, because the incident has occurred, so gave you injection of the immunoglobulin against antibody against this virus, rabies virus. So this is the passive immunity. Basically, these are the immune defense mechanism of our body, and so that's what we finished yesterday. And talk about that neutrophils and the lymphocytes, and then we talk about the other kind of white blood cells, like I'm just going to briefly mention those. There's some basophils, eosinophils. These cells has the granules inside of cytoplasma. Their granules contain different components compared to the neutrophils. The neutrophils, the granule contain enzymes to really destroy the bacteria or virus. But the eosinophils or basophils, the granule contain rich of histamine. What does histamine do? It dilates blood vessels. So in case there is infection, so these granules release the histamine, so the blood vessel dilated and the space between the endothelial cells enlarged, so the neutrophils can come out or the macrophage can come out to the site and do the function. However, if these cells are overreacted, that cause the skin cause the sensitivity. For example, the bumps or the rashes on the skin, especially allergic reactions, is caused by the eosinophils. It's too much eosinophils release too much histamine, so cause this vasodilation and hypersensitivity of the skin. So this is by now finished the red blood cells, the white blood cells, and there's another component which is a platelet. Platelet is not a cell. Platelet is a cell fragment. We have many of the platelets. Usually the normal is 150 to 300. We talk about the white blood cells is about 5,000 to 10,000. So this is the huge amount of platelets. It's just produced regularly by the cells and release those small fragments circulating in the blood, function as coagulation, of course. So if the platelets is too much, or if it's not enough, or the platelet does not have function, then you have the coagulation problem. Either overcoagulated tend to form the blood clot, increase the risk of the thrombosis, either cause the pulmonary embolism or increase the risk of heart attack or stroke. If it is not enough or impaired function, then tend to have bleeding disorder. Usually, the number of platelets, if less than 5,000, may have the spontaneous. That's the cutoff line to have spontaneous bleeding. About 50,000 usually even not have any risk for bleeding. Increase the risk, but for example, the surgery, small surgery, can still go on, proceed, even though your platelet less 50 or 60,000, less than 100,000, which means as long as the function is normal, so the numbers as long as more than 50,000, the procedure like a small dental procedure or the skin procedure or the joint procedure can still go on. But if less than 20,000, then some of the procedures need to be cautious and need to replace the platelet. If then 5,000, that's the case, body has spontaneous bleeding. So if that's the case, your doctor realize, or if you notice you have the skin or have the blood under the skin, that means there's something going on. Just go to the emergency room or call your physician. So this is the platelet. On the other hand, platelet might have functional defect. The number is normal or even more than normal, but just lack of the normal function. If that's the case, there's increased risk of bleeding. So usually it's genetic or autoimmune cause. If, like I said, if you have skin change the color, or you have bruise very easily, or just the spontaneous, you did not do anything, just start to have bruise, not just one side or the whole generalized or many bruise without any trauma, then that's the case. You need to either go to emergency or call your physician. It could happen a lot of time, like the viral infection or other cause of the autoimmune disease can have this problem. So this is about the blood on the category B, alphabetically list of the disease. And I thank you for watching. I'll see you next time.